Hello and welcome to Hive80.com, your #1 online community for health, wellness, and medicine. I'm Brian Banmiller, a national business reporter on CBS News Radio and a Hive80 member. Today we have a fact-filled section on what you need to know about insurance. So, what is Medicare? Medicare is a federal health insurance program for people who are 65 or older, certain younger people with disabilities, people with end-stage renal disease, permanent kidney failure requiring dialysis or a transplant, sometimes called ESRD. Now, when you're able to obtain Medicare coverage, you have two choices. The first choice is the original Medicare. Think of this as a PPO type of insurance where you can see any physician that will accept Medicare patients. The second choice is a Medicare Advantage plan. Now, often this type of plan has a narrower network of physicians that you can see. You'll also likely need a referral from your primary care physician to see a specialist. Now, original Medicare. Original Medicare includes Medicare Part A, that's hospital insurance, and Part B, medical insurance. If you want drug coverage, you can join a separate Medicare drug plan. A Medicare drug plan is known as Part D. Now, you can use any doctor or hospital that takes Medicare anywhere in the U.S. If you choose original Medicare, you can also decide to join a Medicare drug plan, Part D, if you want drug coverage. You can add supplemental coverage, such as insurance from a former employer or Medicare supplemental insurance, often referred to as Medigap, to help pay your out-of-pocket costs, such as your 20% coinsurance. And Medicare Advantage, also known as Part C. Medicare Advantage is an all-in-one alternative to original Medicare. These bundled plans include Part A, Part B, and usually Part D. Now, plans may have lower out-of-pocket costs than original Medicare. In many cases, you'll need to use doctors who are in the plan's network. Now, one big difference in Medicare Advantage plans is that most plans offer extra benefits that original Medicare does not cover. Well, this often includes vision, hearing, dental, and more. Now, Medicare Part A, what's covered? If you're a Medicare Advantage plan or other Medicare plan, your plan may have different rules, but your plan must give you at least some of the same coverage as original Medicare. Now, some services may only be covered in certain settings or for patients with certain conditions. In general, Part A covers inpatient care in a hospital, skilled nursing facility care, home health care, hospice care. Well, Medicare Part B, what's covered there? Well, if you're in a Medicare Advantage plan or other Medicare plan, your plan may just have different rules. But your plan must give you at least the same coverage as original Medicare. Now, some services may only be covered in certain settings or for patients with certain conditions. Part B covers two types of services. Medically necessary services. These are services or supplies that are needed to diagnose or treat your medical condition and that meet acceptable standards of medical practice. Preventive services. Well, that's health care that can prevent illness, such as the flu, or detect it at an early stage when treatment is most likely to work best. Now, you pay nothing for most preventive services if you get the services from a healthcare provider who accepts the assignment. Now, Part B covers such things as clinical research trials, ambulance services, durable medical equipment known as DME, mental health, inpatient, outpatient, partial hospitalization, limited outpatient prescription drug Medicare coverage. That's based on three main factors: federal and state laws, national coverage decisions made by Medicare about whether something is really covered, and then local coverage decisions that's made by companies in each state that process claims for Medicare. These companies decide whether something is medically necessary and should be covered in their area. And for more access to this valuable information, go to the Physician Wellness Center on Hive80.com. And thanks for taking the time today. I'm Brian Banmiller.